Let me ask you a question about the actual treatment of scar tissue, because many people say, yes, scar tissue, if you have it, that's irreversible. And at the same time, we see plenty of videos, including the one that we recorded with you recently, that actually we can treat scar tissues.
We talked a little bit about before, a rapid release device we use, which is really a machine that rapidly goes backwards and forwards, quite a few times a second. And it just basically loosens and breaks up that scar tissue to form a normal tissue again, which kind of flows with the body, where scar tissue doesn't and tears.
From an acupuncture standpoint, we use a technique called surround the dragon or chiseling. And the chiseling is the needle technique, and surrounding the dragon is the location of the needles. And so when you locate the scar tissue, you actually put needles facing towards the actual scar or the tissue that is kind of formed incorrectly or reformed incorrectly. And then once the needles are in, you use kind of a chiseling technique on each needle. And what that does is it makes little micro abrasions on the scar tissue that's underneath, causing it to essentially break just enough to reform, hopefully in the correct way.
Hello and welcome to Polish Your Life Doctors Networking Group. Today we're going to talk about scar tissue, and we're going to talk about scar tissue because a lot of people have it either after injuries or after surgeries, and many people wonder, what can I do to either get rid of it or to maybe soften it up or break it down a little bit? So that's the topic for today. And if you have any questions, you will find more information in the description of the video. You can ask comments below and we're going to answer, but we have a very interesting conversation coming up. I'm here with Ryan Diener, who is one of our hosts. He is the founder and the lead acupuncturist at the Holistic Health Associates in Frederick, Maryland. And I'm also here with the founder and lead chiropractor and functional medicine practitioner and the owner of Dabs Rehab Center in Columbia, Maryland, who is our main guest today. So welcome, Ryan. Welcome, Dr. Dabs. And maybe, Ryan, if you could fire off the first question about scar tissue for today.
Sure, absolutely. I'm excited to be here and excited to be here with you, Dr. Dabs. And so let's talk about scar tissue. So tell us a little bit about, I think the best thing that we like to do is to just start with where scar tissue comes from, give us the basics, and then we can get into the treatment behind it. So let's just start with that. Where is scar tissue coming from for those people that are not physicians or medical practitioners on the call that might be interested in knowing all the places that scar tissue could be formed from?
Absolutely. Scar tissue is pretty much one of the main things I treat, even though it may look like a back problem, a disc problem, or neck problem. Scar tissue is usually involved in some way or other in when it comes to their physical health issues. Scar tissue really is where tissue is kind of gotten out of its main parallel type of look to it, and it basically just kind of went all haywire and became like a spider web instead of tissue going one direction. And it can tear more easily, and it has a lot more nerve fibers to it, and it's just a lot thicker of tissue. It's usually developed because of trauma, for the areas of organs and skin.
So I'm just a follow-up question. So when you get a surgery, you get cut into, it's very clear, you see a scar, and it's very, clearly we know that there's tissue under that scar that has kind of, tangled up in its healing process. And that's why in a lot of ways you still have that potentially that raised location or even just a hard, kind of tissue underneath that scar. It's less easy to discern when you have an injury, but you don't have an actual cut or a surgical procedure. So how do you differentiate between scar tissue and inflammation? When is it one? When is it the other? When is it both?
Well, usually scar tissue is the end result of an area that's being inflamed. So, when something injures the body, and it could be a physical form, but it could also be chemical. So if something obvious, something like a pinprick in the skin, if it's just tiny, it may not develop scar tissue, but when it's a lot bigger, a centimeter, 2 centimeters, it can cause scar tissue because the skin has a problem healing around bigger injuries. But on issues like organs, for example, people can get scar tissue in the lungs, for example, from smoking. So that's more of a chemical scar tissue buildup. But there's those two, and we have different ways of treating both different kinds of scar tissue.
So maybe let me ask you a question about the actual treatment of scar tissue, because many people say, yes, scar tissue, if you have it, that's irreversible. And at the same time, we see plenty of videos, including the one that we recorded with you recently, that there's actually a lot that we can do either at home or in the office setting that is non-invasive, that seems very safe, that actually we can treat scar tissue. So I wanted to ask you about those modalities that people can consider, that maybe there are some things that we can either soften it up or break it down, either at home or in the office. So let's talk about those, please.
Yeah. So the scar tissue I'm usually faced with is musculoskeletal. So that's where someone's injured, say their lower back, and torn muscle fiber or ligaments or cartilage. And that turns into scar tissue. So what we have to do is we can palpate to feel the scar tissue. So we just kind of touch around a person's injury and you can feel this knot in there, and that's scar tissue. And some people call the muscle knots in there, the muscle knots, which I find scar tissue, trigger points. So we call those trigger points, which I believe is scar tissue. And when you press on those nodules, they kind of just melt away. And when you first start pressing on this, they're tender and they can refer pain, down the arm or leg or wherever the knot is felt, the scar tissue is felt. But as you keep pressing on it, the scar tissue tends to melt away. And these scar tissues can also stop the flow of acupuncture, the vessels that run up and down. So they have that issue. So acupuncture can help getting electrical system through the scar tissue. And but the most well-known is pressure. But we talked a little bit about before the rapid release device we use, which is really a machine that rapidly goes backwards and forwards, quite a few times a second, and puts pressure right on that knot, and it just basically loosens and breaks up that scar tissue to form a normal tissue again, which kind of flows with the body, where scar tissue doesn't and tears, creates pain. So those are three methods there of creating lesser scar tissue in the body. But I find exercise and heat help a lot too, to help just break up that scar tissue so it remembers what kind of tissue it's supposed to be, muscle, cartilage, or ligament. And heat brings the area, blood to the area to get rid of the inflammation and provide nutrients for the tissue to grow back as healthy tissue and not scar tissue.
Awesome, thank you. And Ryan, let's talk about what we discussed before about how acupuncture can also be helpful, because we talk about doctors' collaboration and we talk about providers' referrals. So I want people to understand that while one provider may be able to give you solutions on one side, it's very good to sometimes consider multiple different providers as a way to get a more comprehensive treatment. So on the acupuncture side, let's talk about the one that you just mentioned before we started recording.
Yeah, sure. I think Dr. Debs makes a really good point that, heat and stretching is really important when it comes to scar tissue. But what most people don't realize after they've had an injury is that they will rest, and then they will start, going back to activity, but they never actually break up the scar tissue. And I think to your point, Dr. Dads, that's why it's so important to do something like rapid release, or to really get in there and palpate and really break up that tissue. And so from acupuncture standpoint, we use a technique called surround the dragon, or chiseling. And the chiseling is the needle technique, and surrounding the dragon is the location of the needles. And so when you locate the scar tissue, you actually put needles facing towards the actual scar, or the tissue that has kind of formed incorrectly or reformed incorrectly. And then once the needles are in, you use kind of a chiseling technique on each needle. And what that does is it makes little micro abrasions on the scar tissue that's underneath, causing it to essentially break just enough to reform, hopefully in the correct way. And so that's the primary technique that the acupuncturist will use when it comes to treating scar tissue.
That's pretty interesting. So Ryan, can you do that with any tissue? Muscles, cartilage, of course, skin, but what kind of tissue can you use that on?
So we'll use the chiseling technique on lots of different musculoskeletal issues. So it's the location of the needle that defines one component of the treatment, and then the technique on the needle that defines the other. And so whenever there's anything from a tendon that is strained to a frozen shoulder to scar tissue, you might be using something like this. But if you're dealing with the pathway, you might use a chiseling technique all the way up the arm, but following a pathway that goes towards the problem. Strain here, we might be using points all the way going down here, but we're using that chiseling technique all the way through the tissue. So the entire fascial plane starts to get that vibration and get that electrical conduction. So, different methods for different types of conditions, but the technique can overlap depending on what you're looking at.
Interesting.
Yeah. And I wanted to fire a question back at you about the rapid release technique. So we use something, I don't know if this is rapid release or not, but we use, something like this. And, you hold the trigger and then the little ball looks like a jigsaw, and the little ball kind of like, I'm not going to do it because it's super loud, but it's like, it bounces up. Huh?
Yeah. I've seen those. It's almost like the extracorporeal shockwave therapy that physiatrists use at people's feet to break up scar tissue called fasciitis, plantar fasciitis. They use a device similar to what you have there, but I think their device it goes deep and hard and fast, and it's so much pressure that they have to numb your foot. Your device probably feels good, and you don't need to numb the foot, so it doesn't go as deep and hard, but it definitely can be used to break up scar tissue. So in between what you have there, which is more like a thumper massager, which worked great on muscle tension, but between yours and the extracorporeal shockwave therapy used by the podiatrists, we have the rapid release. So it goes in between. So it's a lot of pressure, and it goes extremely fast. And you'll notice the difference between the two you have, the one you have and the one we have. And but it doesn't hurt. So therefore, you don't have to numb the area. So it takes a few treatments with a rapid release to break up the knot, but you don't have to numb it at all. Whereas with the podiatrist version, first of all, it's very expensive. It's like $2,000 just for 1 foot. But our machine, may take 10 visits sometimes to break up a knot. There's usually only one visit, but it takes a while to be in the office and get all that done, and it doesn't feel real good after. So I prefer the rapid release for that. And your thumper machine there is going to feel good on muscle tension too, because it will work as well.
Right, and that's usually what we use it for, is more muscle tension than scar tissue. That's why I was curious.
Yeah, those feel good. Those kind of, it doesn't break up. I mean, it could say break up scar tissue, but more like muscle knots before they become huge amounts of scar tissue. So probably does the pre-knots, and the rapid release will do a little more of a scar tissue, I find, but it won't go. It won't necessarily fix plantar fasciitis when using it, because but it will fix tennis elbow, golfer's elbow, the trap, upper traps, people have those big trigger point knots in there. It'll fix those. A rapid release will. So having a combination of acupuncture, doing the what's a cavitation is it called, that you're doing with a rapid release, I think it'd be phenomenal.
And the rapid release, is it like does it feel like a vibration? What's the sensation?
Pretty much a heavy duty vibration. So it's so you ever seen a Dremel work? And a Dremel works very, very fast. It's similar to a Dremel, but it has a rubber piece on the end so that it doesn't create harm to the skin. So it just goes rapidly fast in an area. It feels really good. It's like someone giving a massage, 10,000 times a second kind of thing, rubbing the area really fast.
Wow.
Yeah, Ryan, I wanted to let you know, when I tried it first time, the rapid release,
Mhm.
it feels almost to the point that it's almost ticklish because it's so fast that you don't really feel the individual hits, but you feel like the flow of, of everything just kind of like really tickling you. Unless you press harder, then you actually feel, that it can get a little bit intense. But it's very, very interesting. I wanted to also address maybe some of our viewers who are watching this, and they are the people who like to do everything themselves. They're like, okay, I get it that the providers have the magical equipment and I may use it, but what can I do myself at home? So that's a question to you, Dr. Dabbs, is what would you say would be kind of like the first line of defense or the first line of action that they can do at home? And also some of them love pills. Like they will just, take a lot of supplements. Like I'm going to take glucosamine and this and that. And I'm going to take the hydrolyzed gelatin. And then I'm going to take the collagen peptides, mix it with vitamin C. And like, what is actually effective? And then what they can do at home that is not BS, but it actually may help them. Maybe they can fix a little bit of that at home, and then at which point they should actually see a provider.
Yeah, I think there's multiple pillars to heal people, whether it's a serious injury or just scar tissue buildup from improper posture or a car accident. But there's 4 pillars to heal, I find. One is a chemical, which is nutritional, you just hit on. One is the mental aspect of stress and just the way mentally to think about it, positiveness. Another one is physical, which is what I deal with as well as nutritional, where they do the physical chiropractic, physical therapy, massage. And the other one I find is electrical component, which is what Ryan does, is the acupuncture component. So when I deal with these 2 of those, which is the physical and the nutritional. And nutritionally for scar tissue, you named a couple of things, but collagen I find is helpful. You could take glucosamine sulfate, but that's never really been proven to work. But glucosamine sulfate is one precursor to collagen. So why not just take collagen? Skip the processes of making it with that. Instead, just drink or take a pill of collagen. And even at the ends of chicken bones are really healthy for you when you eat them. Probably more so than the muscle part. But nobody really wants to eat those. So you eat them in a pill form or a liquid form of collagen, and that can be absorbed as a whole protein, believe it or not, in the body. So they found that to be true, and that collagen can be used to repair your scar tissue, which is collagen that's gone awry. And then if we go in and we do massage work right over that area of scar tissue while they're taking their collagen and of course a whole food vitamin, multivitamin and mineral, then the physical component pushes the direction to break up scar tissue. And of course, it's always good not to have mental stress and to just be positive and think positively to heal. And then the electric component, I'll give it to you, Ryan.
Yeah, sure. I'll jump in. I just wanted to ask you a quick question about that first. You talk about collagen, and one of the key nutritional pieces that is part of the Chinese medicine pharmacopoeia, if you will, is bone broth, which is exactly what what collagen is. What you were talking about with the chicken bones, and like you said, many people don't like it. It's kind of a bland, wet, soup. But if you make it, you can see how much minerals and collagen you actually get from the soup. It's very, very potent. It's really powerful. You can just drink a few cups a day and it can be extremely beneficial. When you prescribe it in pill form, if someone is not doing something to actively break up the scar tissue, can it actually layer extra on there, or do you have to, you know what I mean? How do you, because
that's a good question.
Yeah.
If scar tissue, if it's been there for a long time, for a year or longer, typically it won't go away unless you physically put pressure on it, or acupuncture. I'm assuming same kind of principle. If you're paying attention to it, it'll go away and the collagen will replace it. Collagen by itself won't really fix it because it has no reason to just, scar tissue, once it's set in there, is not going to change because you take the collagen. So, because your body will make collagen, But it's just better to take more collagen while you're breaking up scar tissue, so it can grab onto something to heal us all.
Yeah.
So,
Yeah, that's similar philosophy from our point of view as well. So that's interesting. That's great.
Yeah.
So to answer the question with a little bit of add-on, what other things besides taking the supplementation? So I understand the collagen would be a good idea for people to do, but the way I'm hearing is that it's a very good idea only if they're doing something to actively break down the scar tissue at the same time. Another thing that I heard a lot is that when people take collagen, they need to make sure that they also take vitamin C or have enough vitamin C in their system, right?
Absolutely. And calcium.
And then the last one is, what are some of the things that people can do physically to their body or to their scar when they're trying to fix something at home, but maybe they don't have the muscle release or rapid release or any kind of massagers, but they're just using their fingers and pressure and try to, follow some YouTubers that will give them different advice. I want to make sure that people are not making any mistakes. And at the same time, a quick disclaimer to everybody watching: we are not giving you advice what to do. Definitely consult it with your provider. But I want to get our viewers familiarized with the opinion of Dr. Dabbs and Ryan, because I think it's important to listen to to practitioners who have a lot of experience instead of a YouTuber who just learned something from another video and now is going to give you advice. So Dr. Dabbs, if you could let people know what people can do to actually, mechanically do something with a scar tissue. Let's say it's tennis elbow. Can they actually do something themselves?
Yeah, they can. They can put heat on it. Heat's good for 20 minutes, hot as you can stand. And also they can massage. You just put a lot of pressure and just kind of rub it, around in a circle. And, every day you can put pressure on it for about a minute or two. Will help break it up. And then doing exercises. So, if I have a tennis elbow, I may do an exercise where I'm going to just lift my wrist up like this and hold a 1 pound weight. And I'm gonna flex it and then extend it. So I'm gonna stretch and use it to break up scar tissue. So exercise is a really good way of breaking it up.
Very good, thank you.
Sometimes it's so difficult, you got to put the pressure in there or get some kind of treatment in there. And it's funny, the one thing about nutrition is if you have bad nutrition, then scar tissue tends to prolong and multiply in people who don't have healthy diets. So if you don't eat a healthy diet, you can expect a lot of scar tissue. Sometimes chemicals such as perfumes, for example, they can contribute damage to the adrenal glands, and those type of chemicals will destroy the adrenal glands, and they'll be slowly. So when you have adrenal glands aren't working properly, which they right above your kidney, then ligaments don't hold together very long and scar tissue builds up tremendously. They call it fibromyalgia in a lot of people. When they have knots all over the body, they put a name to it, fibromyalgia. And that's just what people have, scar tissue knots all over their body, and you don't know why. But it's really because of adrenal stress. So mental stress drains adrenals, chemical stress such as perfumes. So really healthy living, healthy air, and healthy thinking really help also that they can do at home to prevent scar tissue buildup and break it down.
Very good point. And thank you for bringing it up, because a lot of people talk about fibromyalgia and it becomes one of these terms that is just so popular, especially for women. And even one theory, I have no idea if that is relevant to the scar tissue here, but it looks like it may be. So I heard that many women suffer from that, and that could be because of the amount of toxic chemicals that women tend to put on their body, because they use a lot of lotions, and some of those lotions also contain some of the ingredients that may be really bad. So would that be accurate? Would that be possible?
Yeah. Yep. Yeah. As I was saying, the reason why it's in women, 90% of people with fibromyalgia are women, and it's because it hasn't been quite proven directly yet, but it's definitely heading that direction. That shows that women use a lot more perfumes, as you said, and their lotions to spray on, the soaps. and that cakes up on the skin and goes through into the body and affects the adrenal glands. And when adrenal glands are your fight or flight organ and the stress organ. So when that isn't working very well, then your ligaments tend to elongate and stretch, and they don't basically hold everything together properly. So scar tissue builds up, and that's fibromyalgia. And so, yeah, right on the nose there.
Very cool. I mean, very, not very cool, but very good to know, and very cool that
Yeah.
we as you know, as men, sometimes we maybe, you know, this is a little bit of an advantage that we don't use so much of those chemical on the skin. And then advice for women is basically make sure that if you have any kind of lotion and a cream, instead of looking at, you know, your friends using it and having a very good commercial, just make sure that you know what you're putting on your skin, because sometimes it may smell nice, but it may be poison. So that's pretty important. I have
Even
one. Uh-huh.
Yeah, sorry. I said even the natural stuff. You see natural perfumes, you know, with real rose oil stuff, but even that can cause harm because, you know, you ended up getting a gigantically concentrated a dose of this rose oil or whatever oil that smells good, but you think it's from a real flower, organic, so it'll be okay, but it's not. Stay away from all the odor really that's concentrated like that.
Got it.
So sorry, what was your question?
Yeah, so I want to ask a question because I understand, I'm trying to kind of like be in our viewers' shoes, that maybe because we have two types. One is a provider, and for some providers, everything is pretty much already obvious because they understand the basics. But there could be somebody who is maybe their family member is suffering from fibromyalgia, or maybe they have a scar tissue after a surgery, and especially in the second part, the scar tissue after injury or a surgery. What I was finding out is that it's very important to start the treatment for the scar tissue at the right moment, meaning is that we shouldn't do it too early. But how do we know, or how somebody knows when that right moment is? Because somebody just had a surgery. Do we just count days, or there's some physical symptoms that we can see, like, hey, I may be ready to start rubbing it. I may be ready to do some rapid release. What would be a good moment to start doing it?
I mean, personally, right away. I'll give you a great example. Car accidents. Someone got into maybe a 7-mile car accident, a little fender bender, nothing major, right? But that puts about 1,000 pounds per square inch on the neck, on the cervical spine. And you know, they may have stiffness the next day or two, but they may not. But that definitely caused scar tissue buildup, and that's the start of it. And a lot of people just ignore it, and they say the pain goes away in a day or two, and they think they're fine. But that's when arthritis sets in, because if you have scar tissue in your cervical spine between the joints, which always happens 100% of the time after a minor car accident, it will end up turning into scar tissue, which attracts calcium, and now you have arthritic degeneration. Started off with scar tissue. A lot harder to fix once it's in there. You can't really reverse calcium growth of arthritis. And it's much easier to get rid of the scar tissue that's forming in there from the accident. So it's forming because it's trying to stabilize everything from the accident, but it goes overboard and then ends up turning into that arthritis. So right away would be the answer for getting treatment.
Got it.
Yeah, same for us. Yeah, we do the same. We recommend the same. It's like the body's going to stabilize it one way or another, and it's either going to stabilize it with an excessive amount of scar tissue, or it maybe it takes a couple extra days, but it heals the right way. And long term, you're so much better off coming in sooner, and and really getting that treatment early.
Yeah,
got it.
Yeah, when I put up an X-ray of someone's neck, they come in with neck pain, and I'll look at their neck, and it looks like degeneration. And they might be 40 years old and they got some pretty advanced degeneration. And I'll go to them, I'll go, did you have a car accident 20 years ago? And they go, yes. I can tell if it's 20 years ago, 30 years ago, 10 years ago, just by the amount of bone spurs they have in there. And they almost always go, yes. And I could tell how long the accident was. And whenever I ask them, did you get treatment for it? They always go, no, which is why they got the arthritis in there. So if we said yes, they probably wouldn't have had that arthritis in there.
Yeah.
Not at any age.
I want to go back just real quick to the tennis elbow conversation that you mentioned before. I always thought that tennis elbow was strictly an inflammatory condition. You're referring to it more as in the scar tissue conversation. So can you speak a little bit more about how you differentiate those two things? Because the tendon clearly is inflamed. It clearly needs to be, that inflammatory pathway needs to be kind of recalibrated. But you're talking about it from the standpoint of scar tissue. So help me understand kind of how you
Sure.
see that.
So when you have a similar tennis elbow, I can palpate the knot that's sitting there that causes all the pain, and that's where the swollen tissue is. But that it turned into a trigger point, which typically sends pain outward from it, down the arm, up the arm, and that's the start of scar tissue from overuse. So if someone's hitting a tennis ball a lot, and for example, usually it's the keyboards of a computer will cause it too, but they're doing a lot of, say, tennis, and they're hitting the ball a lot, practicing every day, it'll start to tear that little tendon in their elbow. And if they keep playing, it turns into scar tissue, because otherwise it's going to rip, the whole muscle going to rip in two. So it tries to make itself stronger by causing scar tissue. And that scar tissue you can feel underneath the skin. But pain comes from inflammation. So, and scar tissue pretty much is only built up after the pain or during the pain. So, and pain is always inflammation. So inflammation, scar tissue kind of go hand in hand. First inflammation, maybe a tear, then scar tissue develops if you leave it long enough. So, yeah, so that if you palpate a knot underneath their tennis elbow, that's a scar tissue developing.
Interesting. Yeah.
And most people have that. You can find it. You just press on it. Sometimes it's just swollen tissue, and if you catch it that early, then it hasn't turned into scar tissue. So it's a lot easier to fix.
Right. But most people, once they come in for treatment, it's because it's been chronic. And it's been for a while.
I think acupuncture, like tennis elbow, is a little mysterious versus other tendinitises, I find, because it tends to stay and last longer than anything else. Even if you brace it or you stop them doing the activity like tennis is causing it, it just stays and stays and stays. And to me, it seems to be more something's wrong with the entire body, and that's why it's there. So, or it could be coming from the C5, C6 nerve root from the spine being pinched a lot. Could be that too. But if systemically they're not healthy, I find tennis elbow develops. It really has to do with your entire chemistry of your body. Really plays a factor in tennis elbow more than any other kind of tendinitises. Do you find that too, Ryan, at all? That they play a little different?
Definitely. Tennis elbow, or seems to be one that is really, really resilient, really chronic. It takes a much longer time to address, even than, say, tendinitis in knees sometimes, which is a very complex joint. But if you can get somebody to stop running for a little while, usually we can get that to heal relatively quickly. But yeah, those elbows sometimes will just hang on for months and months and months as you're trying to work.
Yeah, they don't really stabilize like other tendinitis. I don't know why. Yeah.
I wanted to throw in one last question before we wrap up a little bit. Here is, what about the scar tissue that is formed after a surgery? So there is a reason for it, right? Because the body is forming scar tissue as a protective mechanism to maybe stabilize it, to make this area stronger. And I understand that it's supposed to be there, but then if we want to get rid of it, when would be a good moment to start treatment for that if it's after a procedure?
Usually 6 weeks it takes to heal from surgeries. Quite often, most surgeries, 6 weeks is always the one where they have to, say what the doctor tells them to do. And then after 6 weeks, they can usually start their exercises, and they can go off on their own. But the first 6 weeks, the doctors may know what to do with that. For example, a hip, if a knee and a hip has been replaced, they try and get you up out of bed that day so scar tissue does not develop. So doctors are getting up right away. But if you have a new surgery like the tennis elbow, they may have had to fix that, reconnect it if it's torn, or rotator cuff tear. Then that surgery, you may have to heal for maybe 6 weeks before you can do a lot of exercise and activity and massage and other things. I'm presuming, Ryan, you can start acupuncture anytime. Doesn't make or different? You can start right the next day after surgery. It's quite.
We encourage people to come in early. I mean, it depends on the surgery, and we're careful around certain scars not to overdo it. If the joint is still in a stabilizing pattern where it's trying, that scar is really trying to get hold. But I will still use superficial needling in that situation where you're not going very deep. You're not really necessarily going in there and disrupting the healing process. You're actually going in to encourage it. And so a superficial needling technique is really more about encouraging blood flow, encouraging, fluid movement through that region rather than breaking it up. And so we will start with that right away. And then as we get further down the road and you get a sense that the scar has, that the tissue is really stable, 4 weeks, 6 weeks, wherever that seems to be the case, then we'll go in and disrupt it and create kind of like that micro tear so that it heals correctly. And, it's not a perfect science, but that seems to be really effective to do it that way. And that's where one of the things that acupuncture can be so strong with is not waiting that full 6 weeks to do anything. This is something that you can do very quickly to really improve the healing process quite well.
Yeah, exactly. And I would think the needles they create a kind of ablation or just a minor tissue tear to stimulate normal tissue growth after. So it can be the start of the treatment doing that, pushing it in the right direction.
Exactly right. And that's the superficial aspect of it, because you're just doing these little micro tears just to encourage, good tissue growth. And so, yeah, absolutely.
And I think the doctors these days, the surgeons are quite often they're putting in some kind of harsh chemical to create like an ablation or some kind of trauma to the area, so the body focuses on healing it, which is a smart way to do it for some areas. Like I can't go deep enough myself with pressure points, and then your needle probably can't go deep enough on some scar tissue, and the organs are way down deep, and they can actually get to that area with a needle and injecting chemical, which actually creates injury, and it pushes the body going, hey, I'm now new injured. Let's put all our energy into this area and heal itself, and which is what it does. Yeah. So it actually kind of works. It's like deep tissue massage, but doing with a needle and chemical.
And that's a good example of collaboration, because now we are talking about the full circle. So maybe there was a procedure, right? So you as a patient or you as a provider, there is one step that the procedure is being done. Another step is the patient who is informed. They know at which point what they can do. Then they know which provider to go to first. And in this case, it seems like the superficial needling and acupuncture can be a little bit earlier. Then you can look at other providers, maybe like Dr. Dabbs providing rapid release, and you can check, depending on where you are located, you can check who has that, and you can even ask questions. We can connect you to some providers that might have a similar type of technique. And then also there are supplements. And quite frankly, I think it's always a good idea to have, even if you're taking them yourself, it's good to have a guide who's going to tell you which supplements are good for you, because you may be taking a supplement and you just feel like it's not a medication, it's just a supplement, it's over the counter. Some of these things are super potent and powerful, and if you mix the wrong ones, we all know that it can turn bad. So it's important to have a good guide, and I wanted to encourage everybody watching. We will always give you a little bit of a hint of what's happening within the group, and we want you to know what amazing providers we have. But we want you to ask questions and then connect to the providers who are in your network. And if you are a provider watching, join our group, because you will find amazing collaborating partners where referrals are flowing, and all to help 1 million lives through healthcare collaboration. So thank you so much for watching. Big thank you to one of our hosts, Ryan Diener, and a huge thank you to our main guest today, Dr. Von Dabbs. Great to see you today, and see you.
Thank you, Ryan. Great seeing you.
Thank you. All right, take care, everyone. Bye.
All right, bye-bye.